Hey, this is Justine. I just want to let you guys know what happened with me. I had surgery on July 5 on my back. So I had a L4, L5 minimally invasive micro discectomy. And what happened was while I was pregnant, I probably had developed a bulge at L4, L5, and at 36 weeks into my pregnancy, I had a complete disc rupture of the material inside the disc into my back, and it caused some pinched nerves in there, and was actually not able to walk at the end of my pregnancy. I was using a walker. I had to pretty much relearn how to walk, and went through some physical therapy, and I had delivered my baby at 39 weeks, and everything was fine with that. After I had my baby, I was able to walk a lot better. I went home without using the walker, and but I had, since the injury, numbness and tingling in both legs that traveled down through my calves into my first two toes. That ended up resolving in my left leg, but it continued in the right. And I went to a neurologist here in my hometown. I live in Holland, Michigan, and I went to Dr. Lowry at the Brain and Spine Center, and he's the one that did my surgery. He suggested that I do something about it now. He said I could have just let it go and kind of lived with that numbness and tingling in my leg. But later on I would probably need a more invasive procedure done to fix the injury. So I decided to go ahead and take care of it now while it's a pretty much easy procedure. I'm sorry, my dog is bugging me right now. So on July 5, let's see. So I have a 4-month-old baby. He's almost 4 months old, and I am still breastfeeding. So that was something I had to take into consideration when I had this surgery, and everything did go okay with that. I continued to breastfeed. The only thing that happened was I had a decrease in my milk supply the day of surgery, and the anesthesiologist said it was fine for me to go ahead and keep on breastfeeding when I got home from having my surgery. So everything was fine with that. I didn't have any issues with my son. He was fine from it. And let's see, what else happened? Let me explain what they did. Since I still have the numbness and tingling in the right leg, they went into my back. It's a minimally invasive procedure. So they just make a small incision, and then they put the instruments in there, and they slowly make the hole bigger to open up the space that they're going to be working in. And as opposed to doing an open procedure, which would have been cutting a straight incision to the spot and kind of opening up the space to see what they were doing. They only opened up my back a small amount to get to the site that they were working at. Then they went in and pulled the disc material away from the nerve endings that it was pinching, and they just took out that disc material which had gotten into the space that it should not be into. And then they just take all the instruments out and close up the incision with steri strips, and then you go home. So right now I am 9 days out from surgery, and I'm feeling really good. Today's probably been the best day for me. Something that I had to also take into consideration with this is I can't pick up my baby right now. He's about 14 to 15 pounds, and they tell you not to lift anything over 10 pounds. So my family has been awesome helping me with picking him up. I'm fine if I'm holding him. I've even walked around while holding him, but I got to keep him kind of close to my chest. I'm definitely not doing a bending and lifting with him because it's just too much of a load on my back right now. But yeah, everything's been going fine with that. I'm feeling so good. I'm utilizing my hand grabbers from, you know, just the dollar store. We think we got ours at Harbor Freight. They're just the pinch grabbers. I've been using those a lot. Been using my toes to pick things up from the floor as long as I'm holding on to something and grounding myself, and that's been fine. I've also been doing some squatting to pick things up because I can't bend or twist at the waist for at least a month. So, you know, I've been having to try to make that work. I am a mom. I have kids. Fortunately, this week, for the last 2 weeks, both of my my kids have been with their dads. So that's been awesome. And let's see. Yeah, I don't know if there's really anything else that I need to address other than, you know, my weight loss from having the baby has been doing really good. I had gotten back down under 200 pounds a few weeks ago, and today I'm 205, but I'm still feeling some bloating from surgery, and I'm feeling really good. So I can only imagine that it's going to keep getting better. Yeah, so things are going really good for me. I'm really glad that I went ahead and had the surgery. And, you know, unfortunately, my doctor had told me that really the only way to see if the surgery is a success is to give it time and see how you're feeling. So as of right now, I'm not taking any pain medications. They sent me home on Norco and Robaxin, which is a muscle relaxer, and I stopped taking the Norco 2 days ago, and yeah, I can take that Robaxin as needed, and I haven't needed it. So right now I'm just doing Tylenol if it's getting pretty bad, and ice packs. That's it. So I would say that's pretty good, being 9 days out from back surgery and feeling as good as I feel. So yeah, I can show you my incision. My steri strips had just fallen off yesterday, so it's like the first time I had really gotten to look at it. I'll see if I can get it with my iPad here, if I'll be able to get it into sight. I do wear a compression top, tank top. I had weight loss surgery 2 years ago, and right now I'm down 70 pounds from my highest weight. So I do have, and I've had 3 kids, so I do have a lot of like skin and even fat still on my abdomen, that it still puts kind of a load on my low back. So when I wear this tummy compression top, tank top, it just pulls that in for me, and it gives me some back pain relief. So maybe someday I'll be able to get a tummy tuck and get rid of the load completely on my back. But that's not happening anytime soon. All right. So as you can see, it's just a small incision here. I'm not even sure how big it is because I haven't gotten a ruler out to see exactly how long it ended up being. But I think it's healing very nicely. There's still a little bit of bruising there, and yeah, that's okay. So if you're considering having a microdiscectomy to help with your back pain at 9 days out right now, I would say go ahead and do it. Make sure that you have family support who will be able to help you, and be smart with the things that you need to do. You need to walk after you have surgery and don't lay in bed. I have done a lot of standing in the last week because it's more comfortable for me to stand than it is for me to lie down. And get some cheap dollar store grabbers and put them in every room if you have to, but do not bend and do not twist. And if I have more changes or I revise how I feel about having the surgery, I'll let you guys know. Thanks, bye.